The primary aim of care is to prevent and treat bleeding with a deficient clotting factor. Whenever possible, specific factor deficiency should be treated with specific factor concentrate. People with hemophilia are best managed in a comprehensive care setting. Comprehensive care promotes physical and psychosocial health and quality of life while decreasing morbidity and mortality. The wide-ranging needs of people with hemophilia and their families are best met through the coordinated delivery of comprehensive care by a multidisciplinary team of healthcare professionals in accordance with accepted protocols that are practical and national treatment guidelines if available. Acute bleeds should be treated as quickly as possible, preferably within 2 hours. If in doubt, treat. Patients usually recognize early symptoms of bleeding even before the manifestation of physical signs. This is often described as a tingling sensation or aura. During an episode of acute bleeding, an assessment should be performed to identify the site of bleeding and appropriate clotting factors should be administered. In severe bleeding episodes that are potentially life-threatening, especially in the head, neck, chest, and GI tract, treatment with factors should be initiated immediately, even before diagnostic assessment is completed. Administration of desmopressin can raise factor VIII level adequately to control bleeding in patients with mild and possibly moderate hemophilia A. Testing for desmopressin response in individual patients is appropriate. Veins must be treated with care. They are the lifelines for a person with hemophilia. Adjunctive therapies can be used to control bleeding, particularly in the absence of clotting factor concentrates, and may decrease the need for them. Adjunctive therapies are important, particularly where clotting factor concentrates are limited or not available and may lessen the amount of treatment product required. In addition to increasing factor level with clotting factor concentrates or desmopressin in mild hemophilia A, protection, rest, ice, compression, and elevation, or PRICE, may be used as adjunctive management for bleeding in muscles and joints. Physiotherapy or rehabilitation is particularly important for functional improvement and recovery after musculoskeletal bleeds and for those with established hemophilic arthropathy. Antifibrinolytic drugs such as tranexamic acid, epsilon aminocaproic acid, are effective as adjunctive treatment for mucosal bleeds and dental extractions. Certain cyclooxygenase 2 inhibitors may be used judiciously for joint inflammation after an acute bleed and in chronic arthritis. Prophylaxis is the treatment by IV injection of factor concentrate to prevent anticipated bleeding. Prophylaxis prevents bleeding and joint destruction and should be the goal of therapy to preserve normal musculoskeletal function. In patients with repeated bleeding, particularly into target joints, short-term prophylaxis for 4 to 8 weeks can be used to interrupt the bleeding cycle. This may be combined with intensive physiotherapy or synoviorthesis. Prophylaxis does not reverse established joint damage. However, it decreases frequency of bleeding and may slow the progression of joint disease and improve the quality of life. Regular exercise and other measures to stimulate normal psychomotor development should be encouraged to promote strong muscles, develop balance and coordination, and improve fitness. Patients should avoid activities likely to cause trauma. Regular monitoring of health status and assessment of outcomes are key components of care. Drugs that affect platelet function, particularly acetylsalicylic acid and NSAIDs, except certain cyclooxygenase inhibitors too, should be avoided. Paracetamol or acetaminophen is a safe alternative for analgesia. Factor levels should be raised to appropriate levels prior to any invasive procedures. Good oral hygiene is essential to prevent periodontal disease and dental caries, which predispose to gum bleeding.